Welcome back, my beautiful friends. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York. I'm your host, Zen Sams. Up next in our My Healthy Minutes segment, brought to you by Revere Securities, we are featuring Dr. Elizabeth Federick, a PhD licensed professional counselor. She's an influencer of sorts in the mental health services industry. And to add wowness to accomplishment, she is also the founder at Evolve Counseling and Behavioral Health Services, a private practice in Gilbert, Arizona, providing counseling services for children, adults, and families. Now, they specialize in treating depression, anxiety, trauma, relationship issues, grief, and life transitions. And she's going to be coming on in just a few to chat mental health and the ongoing battle we face in America. Now, today marks a milestone in the fight against mental health disorders. That's right. The National Suicide Prevention Lifeline number transitioned to 988 today to make help seeking in a moment of crisis more accessible. Now, experts have expressed concern that the Lifeline is going to struggle to meet demands due to the increase in youth suicide rates during the COVID-19 pandemic. And suicide ideation are major public health crises that can affect anyone, particularly our young people. And according to the National Institute of Mental Health, suicide is the 12th leading cause of death in the United States and the second leading cause of death among youngsters aged 10 to 34. Wow. Now, the U.S. Surgeon General and the American Academy of Pediatrics have acknowledged the growing youth mental health crisis that's been exacerbated by the COVID-19 pandemic and disproportionately affected youth of color and LGBTQIA. Now, when former President Trump signed the National Suicide Hotline Designation Act of 2020 into law, plans were set in motion for a mental health emergency hotline. Well, guess what, guys? Today, President Biden has since awarded $105 million to states and territories to strengthen crisis call centers services to prepare for the transition to 988 as part of the administration's mental health strategy. And here to chat some more is Dr. Elizabeth Federick. Welcome to the show, Supermama.
Hi, Zen. Thank you so much for having me. It's such an honor to be here.
Absolutely. Okay, so let's dive right into it because this is a major issue. And we now know that they're shortening the National Suicide Prevention Lifeline number to 988. And this is going to make getting help in a crisis more accessible. But experts have expressed concern that not all call centers are prepared. What do you say to this?
And I think that's completely accurate. I don't think that even currently there's just not enough people. There's not enough people to pick up the phone, to respond for the rate that we're seeing, how much there's an increase. And as you said, among the younger population, for sure, it's happening. The quality, though, the really benefit of this is that it's not just about texting that or calling that number. It's also about texting the 998. Is that yes? And so that is for this younger generation to be able to text that as opposed to having to pick up and call, knowing that that's their communication method of choice. There's actually a lot of value in that. And hopefully because of the texting as well, they'll be able to reach a broader audience with this because they can respond with multiple text messages at once. So you're absolutely correct. There is a concern that there's not going to be enough mental health professionals to keep up with this. But the idea as a whole is brilliant and I think will be really beneficial.
Well, I couldn't agree more that it would be beneficial. And I could also not agree more that there's just, an underhanded sentiment of, well, we got phase one into effect, but now phase two, like you said, is finding that trained help. We know that in June of this year of 2022, research from the National Academy for State Health Policy assessed state by state readiness for the rollout of 988 and found that only 21 states had enacted legislation to implement and provide funding for the new hotline. And we know for a fact that our youth is in crisis. Just recently, the adolescent behaviors and experiences recent research showed that the overall teen suicide rate had increased during the pandemic overall. So we're seeing staggering numbers here. But let's move on to childhood. And this is kind of one of the areas that you specialize in. And as a mom, as a fellow mom, we know that, our youth is really it's a silent killer, and it's affecting children of all ages. So, childhood is often believed to be this carefree period of life with none of the stresses or anxieties that come with the difficulties of adulthood. But the fact is, however, that mental health issues in children are very common, right? And in fact, 50% of diagnosable mental disorders begin by the age of 14, along with anxiety disorders, major depression, and bipolar disorder. Dr. Fedrick, please help me and help America understand what our kids may not be saying.
Yes, and it's so important because a lot of times kids don't have the verbiage, they don't have the ability to communicate what's going on for them, especially if they're in homes that potentially the parents don't have a template to know how to show up emotionally. They don't know how to meet these emotional needs. They don't know how to communicate in the way that their youth needs. This exacerbates the concern because then the youth feels as though they have nowhere to turn. And we really see anxiety start even, we work with children as young as 3, 4. We see these symptoms really begin early on, and it has a lot to do with environment, but then also genetic predisposition. But then when we couple that with as developmentally going through middle school, high school, all the stressors of those times, the increased stressors with the extracurricular activities, grades, social media, we know takes a big toll on this. And then compounded with COVID-19 and what these poor kiddos experienced throughout that time between the isolation, being removed from peers, that adolescent time of their life is crucial for peer development, for peer interactions. That is most youth's life, is their peers. And so to be removed from that, removed from extracurricular activities, which is where they got a lot of their physical activity, we just saw a huge exponential increase in anxiety, depression, and as we're discussing, suicide rates. And so, these are really normal stressors to begin with that a lot of youth experiences. And then over the last couple of years, what's been added to that, it's no wonder that there is just a clear stress on these kids. And a lot of them don't know where to turn, which is really tragic in addition to it.
Yeah, and they don't know where to turn, like you said. We're seeing this across the country. We're seeing these especially in some of the underserved communities. But you mentioned something: suicide rates. Suicide rates are going up across the country. The U.S. Preventive Services Task Force is pushing now to have all children aged 8 and older screened for anxiety. And children's mental health is of course being called a crisis and a national emergency. What do you say to this? And is this screening a good idea?
I do believe that the screening is actually beneficial because, quite frankly, I wish that we would have social skills classes. I wish we'd have life skills classes, emotional intelligence classes. So I wish that this was rolled out on a larger scale in general. So I do think that the screening for anxiety is actually a great idea. Just like when you and I go into the doctors and we get asked questions about anxiety and depression. And the important aspect of this is that mental health is health, and we can't really reiterate that enough. And there's still such a stigma around it. And so when a child goes into the doctor's office and we're assessing all of these physical needs, we should also be assessing the mental health needs, which is with the anxiety. And often those anxiety symptoms lead to depressive symptoms, lead to withdrawal, isolation. And that's how we get to this sense of desperation and not knowing what to do with all of those emotions in their body. And so I do think that there is a lot of value in starting this early on, checking in, how are you doing? The doctor can intervene early on. And I think there's a lot of value to that.
Yeah, provided that the people that are doing the screening are actually educated in that field and can provide the proper assessment. As my fear as a mom is to have somebody that's either a pediatrician or a teacher assess my child for mental health when that's not their training. So that's yet to be determined. We'll see how that rolls out. But I agree. Yeah, early intervention is key. Now, over the last 3 decades, anxiety, depression, and suicide and self-harm have soared among teens specifically. And in 2019, the American Academy of Pediatrics issued a report noting that mental health disorders have now surpassed physical conditions as the most common issues causing impairment and limitations among adolescents. So that was an alarming read. And that predates the pandemic. And it means there needs to be a closer examination of other possible factors, including Bingo, what you said in your previous answer, social media. What do you say to this?
Yes, it is not surprising at all. So when we think about to when we were children and we think about those peer interactions and how stressful that already was, and worried about what people thought about us and what that was like when we showed up at school. Now, completely put this on a huger scale of this is happening to these individuals, these youth, every single day, every single minute of every single day. They have access to this platform, which puts them on display for criticism, for rejection, for all of these type of worst fear scenarios for us as humans, but especially as an adolescent who's still trying to figure their way through the world, right? Trying to still figure out self-esteem, trying to figure out how they fit in. And so the social media aspect, for sure, the bullying that takes place, the cyberbullying, has led to certainly increased concerns with mental health and even suicide rates. And so it's truly an issue. It comes down to what do we do about it? Because social media is not going anywhere, and that is for sure. And so I think to your point of the early intervention, we need to be more intentional with providing education for parents. We need to be more intentional with even reaching youth with some education, because if a parent isn't going to, parents can receive all the information all day long, but if they don't take it and translate it to their youth, there's no value in that. But if we can find ways to have social media accounts that talk about this, have ways to draw the youth in so that they're learning it on their own, that can be really valuable for helping them to navigate it.
Yeah. So what you're saying is limit social media use. And when you are using it with your kids, make sure you're using the right channels so that the right messages are conveyed. It's a great point.
Yeah.
We have about 2.5 minutes left, and I want to cover something very specific here. It's the growing use of psychiatric medications in youth. And this is one metric of the adolescent mental health crisis, because from 2015 to 2019, prescriptions for antidepressants rose close to 40% for teenagers, compared with only 15% for adults. And this is according to Express Scripts, right? So some health experts have expressed alarm that nationwide major psychiatric drugs are so widely prescribed to children and adolescents, even though many of these medications have not been studied for their combined or long-term effects. And they also worry that some of these antidepressants have been shown to increase the risk of suicide among children. Prozac carries a black box warning of such risks. You have about 2 minutes. What do you say to this?
I would say all of that is true. And also our kids are in need. And so when they are dealing day in and day out with symptoms of anxiety and depression, they don't know what to do with it. They don't know how to manage it. They don't know where to turn. We do have to get them help. Ideally, this help would come in the form of therapy, early intervention, helping parents to be more aware of these concerns so that they can connect with and talk with these kids early on about these concerns. They can be a safe place for their kids. However, because that is not happening in the way that it needs to be happening, there are a lot of times when medication is necessary. Is it being overused? I would possibly say my personal opinion is yes, but is there still at the same time a need for it? Absolutely. To be able to help children to reduce social anxieties, to reduce depressive symptoms so they can just get up and show up to school. There is a need there. And so it's a double-edged sword that I don't think that, unfortunately, there's a clear answer to.
Yeah, well, it's true. You're right. I think every situation you have to assess individually and take it from there. And that's why, because psychiatrists are scarce here and nationwide, 70% of counties in the U.S. lack a psychiatrist specializing in children or adolescents. And the psychiatrists who can be found are concentrated in wealthier areas, with many accepting only private payments. So we know that this is a problem, and we know that we have to have trained professionals like yourself. So thank you so much for piping in. It was very enlightening chatting with you. We are out of time. I'd love to have you come back on again. But honestly, speaking to another fellow mom who does this for a living, it makes me feel a little bit more comfortable knowing that there's people like you out there really tending to our children's mental health. So thank you.
Thank you so much, Jen. I appreciate it.
Absolutely. Guys, will the 988 number save more lives? Well, I believe that, similar to 911, dialing 988 could make it easier in a moment of crisis to access help and support. Every moment counts. That was My Healthy Minutes, brought to us by Revere Securities. Please follow Dr. Elizabeth Federick. Check her out on the gram at Dr. Elizabeth Federick, or head to evolvecounselingaz.com. You're listening to A Moment of Zen right here on 710 710 WOR, the voice of New York. We'll be right back after this.